9 months into the COVID-19 pandemic and more grim records. Another 2,700 Americans died from the virus in just the last 24 hours, and more than 100,000 patients in the U.S. are currently hospitalized. Numbers almost too big to grasp, each representing an individual tragedy.
For me, whereas I can't understand the numbers, I can understand the humans behind those numbers.
After a busy Thanksgiving travel period, frontline workers warning the situation could still get worse.
Things were steady, and then all of a sudden, boom, and it just seems to be nonstop.
California plans to impose new stay-at-home orders in areas where intensive care units are already close to capacity. In Lubbock, Texas, there are COVID patients in need of hospital care, but the city is completely out of ICU beds. The virus also hitting hard at veterans facilities nationwide. This New Hampshire home has lost at least 15 residents, including Ellen Oppenheimer's husband, Martin.
I was married to him for 66 and a half years. I wasn't there at the end. I couldn't hold him. I couldn't say goodbye.
In the midst of so much loss, the promise of a vaccine offering hope. But the rollout will present its own challenges. Pfizer, which had hoped to ship 100 million doses of its vaccine by the end of the year, now aiming for 50 million worldwide because of issues with raw materials in the supply chain.
This is where the product will go.
And with the first round of vaccines possibly rolling out as early as December 15th, hospitals are doing trial runs to make sure everything is ready on day one.
The biggest challenge we have is we don't know what we don't know.
Uncertainty and anticipation as the nation struggles to survive the winter surge.
Now, the hospital here is setting up a drive-through situation where they can vaccinate 1,000 people a day. The challenge here is trying to find enough medical personnel to actually administer that vaccine to these frontline workers because, of course, many of them are working overtime because COVID-19 is surging here in Arizona. So what they're doing right now is trying to get volunteers, and they're also leaning on retired medical staff to help them out.